Good morning, everyone. Good morning. I am Dr. Twin Green, founder, president, and CEO of the Lincoln Option Center, an integrated medical services and mental health state-certified community behavioral health clinic, which is an acronym for CCBHC. The Lincoln Option Center is the first South Suburban coverage area designated CCBHC clinic for the state of Illinois, where care is provided to anyone seeking help with mental health and substance abuse and primary care coordination, screening, and medication monitoring, regardless of age, location, or ability to pay. We have served the greater South Suburban Cook County community and the south side of Chicago for over 30 years. And thank you for joining us this morning for the Red Alert. Red Alert, get it? Yes. On the Black maternal health and mental health crisis in South Suburban Cook County. The state of maternal and mental health in this region is not just alarming, it's a red flag waving for immediate attention. The alarm has been sounding off for 3 decades, but the crisis has not abated. In Illinois, an average of 88 women die each year while pregnant or within 1 year of pregnancy. In South Suburban Cook County, the pregnancy-related death rate is significantly higher for Black women compared to white women, with non-Hispanic Black women being 3 times more likely to die from pregnancy complications. These deaths are attributed to factors like discrimination, social, economic, and structural inequalities. Today, I am here publicly making a call to action for protection of our expected moms and prevent more deaths from occurring in our region and across the state of Illinois. To protect our expected mothers, we must act fast. Legislators are in Springfield right now, getting their budgets together, and we need to be in it. And I'll tell you why. Our proposed solution to this issue, and I'm so compassionate and passionate about it, is to introduce a mobile health clinic which will enhance our CCBHC care model and significantly improve maternal health services. The clinic will cost about $700,000, which is a drop in the bucket for saving lives. The mobile health clinic will be the first of its kind for pregnant women in Illinois. Other states have them, but not Illinois, but we will. Our mobile health clinic is not just a solution, it's a beacon of hope. It is time we go to the maternal deserts where access to maternal health services are scarce to reach them. We have to come out of behind these walls. And that's what this mobile health clinic will do. The mobile maternal care clinic is the option that Illinois must take to save lives and build healthier communities that will save our state billions of dollars in the future.
We need people like Dr. Green, the Link and Option Center, Inc., that's socially responsible, that understands the community to play a role in the process of saving lives. So the Link and Option Center play a critical role in ensuring safe pregnancies and healthy babies by investing in competent support, by investing in Black women and the communities that need it the most. As Dr. Green said, we're in Springfield and we're going to be working to prioritize what's important, and I will be standing in those meetings saying that it's important that we support the mobile unit that Dr. Green is pushing for, because we know that 91% of maternal deaths are preventable if we go outside the walls, as Dr. Green said, and go show people that they're cared for.
Twin Green, founder and CEO of Link Option Center. I want to thank you for your tireless advocacy and commitment to transforming not only the lives of those in the community, but those even outside of our community. She is not bound to just the Southland. Twin is doing work from the Southland all the way to Roseland, and she needs to be acknowledged for that. Strong mental health and access to free and affordable mental health resources empowers mothers to ensure safe journeys through at-risk pregnancies, because their life begins with healthy minds. All lives begin with healthy minds. So the work that is being done to ensure that mental health resources are affordable and available, and that's the difference. We can't just continue to say that, oh, there are opportunities for people to have access. We have to actually bring the resources into the neighborhoods where they're actually making the most impact.
We have needed so much for so long. The only thing I would add to this is that everybody that hears this should contact their elected officials, urge them to support Lincoln Option Center and the establishment of this mobile clinic, and let it stand as an example to other communities, because what's being experienced here is a national crisis. We just want to respond right now in the Southland, but everybody can watch and see what's being done here and replicate it throughout the country.
On December 31st, I actually had an appointment. I went to do my growth ultrasound, and everything was normal. My amniotic fluid was at normal levels, he was moving, and that same evening I had a church event, and I went for a New Year's party, and I started leaking. And I thought it was just, normal, the baby's growing. I had to go to the restroom pretty often. But throughout the night, I kept having fluid come out. And I called my midwife, and she said, you should go to the ER. But because everything was normal throughout my pregnancy, there was no indication that I should be concerned. But Lord and behold, my water broke. And at that point, I was admitted into the hospital, and they said I had to stay in the hospital until my son was born. And so obviously that was a whirlwind, because I was expecting to make it to full term. But one thing I will say to answer your question is that I was very adamant about wanting to be at a birthing center, have a midwife, have a doula. I wanted to ensure that I had the best care for myself and my son. And so I do believe that despite me having a preterm labor, that it did help me to go to good hospitals to be able to deliver my son. So I did deliver him at Stroger Hospital downtown, which was good.
I think I know what Davis that was the senator's recommendation that Dr. Green meet with legislators.
Bolivian, not Bolivia. Right.
Which one?
Thank you. If you have a business card, please drop it in the jar on your way in or out.
So we're ready to make it happen. All we need now is funding. That's what we need right now. We can't do it without the money. But once we get the money, we can roll.
deliver my son. So I did deliver him at Stroger Hospital downtown, which was good. And my doula was able to come as well and be an advocate for me. My midwives were calling me and giving me input and how to communicate with the doctors, my needs. And so despite things not going in the direction that I wanted it to go,